Hi, everybody, and welcome to another edition of Alaska Health and Fitness Magazine. I'm your host, Tim Baxter. We've got a lot of great information to share with you over the next half hour, especially if you or someone you know suffers with varicose veins. Dr. Ty Bell will be joining us in just a moment to tell us that it's easier than ever to rid your legs of those pesky veins. Coming up a little later in the program, you'll meet Alaska's sleep doctor, Dr. John Krehlik. If you or your sleep partner snore or have other sleep issues, you'll learn how easy it is to find out what's wrong and get it corrected. So let's get started with a visit to the Soldotna office of Vein Specialists of Alaska. We had a chance to visit with Dr. Ty Bell, and he was telling us that varicose veins are not unusual at all.
So varicose veins are a very common problem, and most studies estimate there's about 25% of the population that have this problem. It's an inherited trait. It's made worse by people that work in professions that they sit a lot or stand a lot. And being overweight, being pregnant are all things that tend to aggravate the venous system. So we do treat varicose veins here at Vein Specialist of Alaska, and the treatment has gotten much easier over time. And frankly is almost a walk in, get the veins fixed, walk out, take it easy a couple of days, and then you're back pretty much in action.
They got me all set up and everything, and he, went through the procedure of what he was going to do step by step. To me, it wasn't, very long. It was a fast procedure. He explained everything to me to where I knew what was going to happen. And before I know it, I was up and walking out the door. And I feel great. My leg feels great. My leg is healed up, and of course I had a little bit of bruising, but no swelling at all. I had no pain or anything, and yeah, it's great. I have no pain now. I can work 8-9 hours a day on my feet, and I come home and my leg feels like it was before I even had the varicose vein. So I'm very pleased with it.
The procedure is moved out of the operating room in the hospital, now done in the office and sometimes in a surgery center setting. And it basically involves just being numbed up, laying still on the table, and we insert a catheter into the problem vein or veins, and then insert a heating device. And at Vein Specialist of Alaska, we use two types. And we vary that depending on the anatomy we see when we do an ultrasound to assess the problem. Sometimes we use a laser fiber that of course is very intense hot light energy. And sometimes we use what's termed a radio frequency fiber, which is, I tell patients, is basically like uncoiling the eye of a stove, putting it inside the vein and then turning it on. And so with the electrical, very intense heat, you destroy the vein. Most patients choose to just be awake for the procedure, and it's just not difficult. I hear all the time when they leave the office that it was not near as bad as they thought it would be. And not to throw the dentist under the bus, but I hear almost uniformly that it's not as bad as going to the dentist.
It's pretty simple, non-invasive. You're alert, oriented the whole time. It didn't hurt. You don't shed a tear. And your leg looks better.
Vein Specialist of Alaska, I think, has a little edge up on some of our other vein providers in the area, and I think it resorts back to the staff. I feel very fortunate to hire good people that like working for us. It's not just a paycheck to them. They really take a keen interest in what we do and making sure our patients are well cared for, questions answered. From the moment they call with interest or questions till they finish the procedure and we're checking them and getting ready to send them out the door to go live their life after things are completed, we really make a bond with those patients, and that's me included, but staff included. And one reason I think is because we keep our staff to a small number. I ask my staff to do a lot, but they respond by going that extra mile to do that. And I think patients, we ask for feedback, and time again, they praise our staff, which makes me happy.
Shauna I've known for quite a long time, And she is very professional, very nice, easy to get along to. She was very knowledgeable on the information and everything that she gave me to come down here.
One of the main reasons I decided to join Vein Specialists of Alaska was that they are so compassionate about how they treat patients, as well as they don't just treat patients to treat them, they treat them because they actually need it and they think that they can help them. And so for me, that's really important, because just to do procedures on patients it's not ethical, first of all. And I think that patients really respect that. So that's been really great. Dr. Bell he's an amazing boss. He's an amazing doctor. He's very open, he's funny, he treats patients with respect. He makes people feel like they are part of something when they're here. And they are very pleased that he doesn't just treat them like another patient coming in to get a consult. He makes them feel like themselves and they can be comfortable here, which is really important.
The most rewarding part is obviously getting rid of these bad symptoms that people have of varicose disease. Varicose veins hurt. And even the people that have painful legs, they have swelling and or pain in their legs and they don't have the bumpy, lumpy veins to show for it, or they come in with restless leg symptoms and they've never been diagnosed. Many times those patients do have vein disease, and fixing it rids them of just all kinds of chronic complaints. The heavy, tired feelings go away. Cramping, burning, stinging, itching, throbbing, all go away, and restless leg almost uniformly goes completely away, or if it doesn't, it resolves at least 85–90%. So people are really pleased. So that makes me most happy. The other part that makes my job really enjoyable is I get to meet great people. And they come from all walks of life, but Alaskans are fun people, they're interesting people, and I feel like I'm better off for having met them.
Talk about the procedure itself. Folks get scared about these types of things, and rightfully so. Was it better than you thought it would be?
I actually anticipated more pain, and I was very pleasantly surprised how comfortable it was. And I know they would let you take different kinds of over-the-counter medicines for pain, and I was only taking 3 Tylenol a day.
Wow.
And it was really some topical medicine to put on if there was discomfort, and I was just really pleased at the lack of pain.
Yeah. Bonnie, how about you?
Yes, it was great. I didn't even have to take the pain medicine to have the procedure done. They had me do a little bit the first time, but I never took any after that, and I recouped just really, really well.
We do treat varicose veins here at Vein Specialist of Alaska, and the treatment has gotten much easier over time.
My varicose vein was sticking out, protruding, and I didn't want it to do that anymore. It's pretty simple, non-invasive, you're alert, oriented the whole time. It didn't hurt, you don't shed a tear, and your leg looks better.
Call my dad at Vein Specialist of Alaska.
Alaska Health and Fitness Magazine continues with our visit to Vein Specialists of Alaska at their Soldotna office. We continue our visit with Dr. Ty Bell as he talks about restless leg syndrome.
And accompanying that would be something called periodic limb movement disorder. It's interesting because patients, and a lot of times their spouses or their significant other that they're sharing a bed with may notice it more than the patient themselves. But it's an incessant feeling of, sometimes described as creepy crawling sensations, or an incessant need to move the legs, and you can't get them comfortable, to even violent, more kicking type movements. And it occurs at night, most commonly about the time someone retires to bed or during the night while they sleep, and it tends to cause very poor sleep quality. So not only the patient suffering with this, but again, often the spouse or significant other, their sleep is impaired just because they can't sleep for the movements going on next to them. And what a lot of people don't know is restless leg and these movement disorders of the legs that occur during sleep are strongly correlated with venous disease. There's at least 4 published studies I know of, and in my own clinical experience I've seen this, that a lot of people walk in the door, if they have visible varicose veins, then it's easier to diagnose, obviously, and then we fix the problem veins with our minimally invasive office procedures or surgery center procedures, and typically the problem goes completely away, and it makes for a happy patient and a happy significant other or spouse. But a lot of times they don't have any visible evidence, and fortunately they have read enough or heard something like this now and realize that it's worth having an evaluation. About 50% that walk in the door with these symptoms will have venous disease, and a simple ultrasound tells us. And then again, if we fix it, symptoms markedly improve or go away. But I feel bad for the ones that are living with this condition and just don't realize it's as simple as coming in for an ultrasound. And this may sound self-serving, but I almost hope they have the problem, because if we fix it, typically they're going to get dramatic relief and not be stuck on medications or stuck with a problem that doesn't really respond otherwise. At Vein Specialists of Alaska, we accept insurances of all types. We have agreements with most of the major insurance carriers, the private insurance carriers, and we also have arrangements with Medicare, Medicaid, TRICARE, and now with the Affordable Care Act, most people can find insurance through the marketplace, and again, we will work with them and file insurance for these patients, so we take that burden away. For the few patients that do wander in without any insurance at all, we really try to keep our prices down. It obviously is not, it's fairly expensive just to run a medical practice, but I look at our cost and really have a hands-on with that and try to keep it reasonable for patients so it doesn't break the piggy bank.
One of the main reasons I decided to join Vein Specialists of Alaska was that they are so compassionate about how they treat patients, as well as they don't just treat patients to treat them, they treat them because they actually need it and they think that they can help them.
They went through everything step by step. They took the time if you had questions. It wasn't like a rush in and out job. I was just pleased with it.
If you have varicose veins, call us today.
If you suffer with varicose veins, make this the year that you do something about them.
We hope you're enjoying this edition of Alaska Health and Fitness Magazine. I'm Tim Baxter, your host. And if you miss any part of our program, you can catch it online anytime at alaskahealth.net, www.alaskahealth.net. On the website, you can not only catch our latest TV show, but you can read the print edition of our magazine as well. We hope you'll check it out. Now we continue with our visit with Alaska's sleep doctor. I think you're going to enjoy this. Dr. Krehlik is back with us, and we've got a lot to talk about. First of all, people keep saying, how do I know if I have sleep apnea? The big thing is snoring, right?
Oh, the big thing is snoring, Tim. Any type of snoring, especially loud snoring, is an indicator of sleep apnea. There are other indicators too.
And what are those?
If someone's overweight, if they have a diagnosis of obesity, if they have high blood pressure, heart disease, diabetes, all of these indicate that you might have sleep apnea.
Age?
Age is important. The older you get, the more frequently we see sleep apnea. Men have it more than women until women go through menopause, then women catch up with men.
So once somebody suspects that they may have sleep apnea, or they certainly have snoring issues, what's the next step? What do they need to do?
All they need to do is call us, because we can take care of them no matter where they are in Alaska, Tim, because nowadays the preferred method of diagnosis is a simple home sleep test. And this device, Tim, is so small, so easy to use. We send it home with patients and they use it in the comfort of their own home. No more do they have to go into hospital labs or other laboratories to get diagnosed for this very significant illness.
And we've talked to several of your patients, and they have said that one of their fears was having to go spend the nights in a strange place, all wired up. And they said when they talked to you and realized they didn't have to do that, they were jumping and screaming.
Oh, it's so much easier, Tim, than it was in the old days. This day, over 95% of people we can diagnose with this simple home sleep test.
The most important thing that I would tell anybody who's even thinking about this is it's not hard, it's painless, it's easy, You just come in, they hook you up with a machine, you go home. It's not even a machine. It's a little thing that's less than the size of it's about the size of a garage door opener. You tape that to your chest, you put this cannula in your nose, which you don't even notice, and then you put the pulse oximeter on your finger. Tape them down and go to sleep. You don't really even notice it. You wake up the next day, you bring it back to Melissa, she runs the test. 5 days later, she lets you know what's going on. And then if there is something going on, you come in and they hook you up with the machine, and then they monitor you for a while. It's really simple, and they work really well with me. I don't have a lot of options as far as seeing doctors in the daytime, so they were more than willing to stay here later in the evenings for me to come by, just to drop the machine off, or to see the doctor, or to see Melissa. And she was always ready and available to answer any questions I needed answered.
And Tim, the other thing is, lots of people come to me in my offices throughout the state, but if they can't come to me, the nice thing about this simple device is we can send it to them. We can work with their primary care provider, their doctor, nurse practitioner, physician's assistant, whoever it is. And we can not only diagnose them quickly, we can get them treated quickly, Tim.
So they don't have to come see you?
Not necessarily. I'm more than happy to see the patients, and certainly in patients who live in the big urban centers of Alaska, it's very convenient for them to come. I have offices in Juneau, Anchorage, Wasilla, and we're opening offices in Fairbanks. So it's easy for them. But the people who live in more remote areas, they can contact my office and we can make arrangements. There's also times, Tim, whenever I make trips to smaller towns, Petersburg, Wrangell, Alaska, and places up north.
But the easiest thing for them to do is just to call your office and you'll get them set up.
That's the easiest thing to do, Tim. I have a very good staff, very knowledgeable staff about sleep apnea, and they are on top of it. All of my patients rave about my staff, and not only do they know about the diagnosis of this significant illness called sleep apnea, but we also treat it very quickly.
If you or your sleep partner is snoring like this, it's time to call Dr. John Krehlik, Alaska's sleep doctor. Sleep testing is easy and can be done in the comfort of your own home. Call Dr. Krehlik today. No matter where you are in Alaska, Dr. Krehlik fixes snoring. Before Dr. Krehlik, after Dr. Krehlik.
For me, I think I didn't understand that snoring is a health problem, and I didn't realize its ramifications. I thought it was just a bad habit and annoying to others I might be with, and, occasionally waking me up. And, it's not a very attractive kind of symptom, but I didn't realize how dangerous it could be.
Snoring is a very important factor in sleep apnea. If you or someone you love snores, then they could be at risk for sleep apnea. And the important thing about, Tim, is that sleep apnea can lead to other significant medical illnesses, including high blood pressure, heart attacks, strokes, diabetes, motor vehicle accidents, and a really big one, death. People actually can die with untreated obstructive sleep apnea, Tim.
Because part of sleep apnea is where you actually stop breathing.
I'm glad you brought that up. Sleep apnea is where you stop breathing. And I have seen people stop breathing 5 times an hour, and I've seen people over 100 times an hour stop breathing. Every time you stop breathing, Tim, every time, then that puts a stress on the heart, the brain, the metabolism of the body, and it can really hurt the patient in the long run.
The most exciting thing is that I had on medication for high blood pressure, and my blood pressure had started to go down. So I have a hope that maybe someday I can not have to take blood pressure medication.
When you are not getting enough oxygen during the night, year after year after year after year, there's going to be, nasty side effects to that. And the immediate difference is that you're going to be feeling better, more energized, and feeling more rested.
This is a significant illness, and we're trying to get the word out so that people can be diagnosed and treated. We were talking about other factors besides snoring, which can indicate that you have sleep apnea. Another common factor is excessive daytime sleepiness or fatigue. You just feel tired all the time. And so many people have this, and they may have sleep apnea. And sleep apnea is important to diagnose because it's easily treated with our modern, what are called positive airway pressure devices.
The results have been great. I'm very happy to have stopped in here because they were very quick, very efficient in letting me know what was going on with after my sleep study. Dr. Krehlik's assistant fitted me for a APAP machine, and
That's the new automatic, which is kind of cool, isn't it?
yeah, and it was quite the adjustment just to putting on the headgear and getting used to it. But you do, over a period of time, once you get used to the headgear, you do see the difference between when you would wake up before having the equipment on, where you'd be very groggy and tired, and then after 2 or 3 days of wearing the headgear and using the equipment, that you really feel refreshed.
So you could tell a big difference during the day.
Oh, major difference. Yeah, there's no being tired in the middle of the day, or if you're sitting down doing paperwork or something, or just relax for a minute, you don't really just drift off and fall asleep because you're just so tired because you didn't get enough sleep or proper sleep the night before.
I always counsel my patients when they're first starting on the machine, on the positive airway pressure device, that they might be, in a sense, lucky. There's about a 10 or 20% group of patients who wake up after the first night and they feel great. But 70-80% of the people end up taking a number of days to weeks to start feeling better and better as time goes on. But ultimately we do. The other big thing, Tim, that I want to mention is that the aspect of relationships. So often the spouse has terrible sleep because the patient is not sleeping well. And if we can just fix the snoring, fix the sleep apnea, everybody in that relationship feels better.
You're changing lives, you're changing families, aren't you?
Oh, absolutely. And not only that, we're helping people keep jobs. I have seen people come in here close to tears because they're about to lose their job. And because they're so tired, they don't know what's going on, we make the diagnosis, we treat them, and they're back at full employment. So it's very important. It's a very satisfying aspect of medicine to be able to treat the patient, diagnose the patient easily, and get them back to work, have them improve their relationships, and cut down their risks for other significant medical illnesses.
Okay, let's remind everybody again how easy it is to make that phone call and get started with this process.
Very easy, Tim. All they have to do is call our number, visit our website. We're called alaskasleepdoctor.com. Just pick up the phone, go to the website, give us a shout, and we want to take care of you wherever you are in Alaska. And
emphasize that because you truly can treat anyone no matter where they are in Alaska.
Absolutely. We've treated people from Barrow to Ketchikan and every place in between. So it's easy to do, and it's important to do, Tim. It's easy to get diagnosed, it's easy to get treated, and it's very important for your health, for your relationships, and just for overall feeling better in your life.
And actually, it could save your life.
Absolutely. Absolutely. And I've seen that more than once, that people get on this machine and they are so much more invigorated. And as we talked about earlier, there's always a reluctance to start on this mask at night, but that's not the first step. The first step is get the diagnosis. And then we work with you to help you tolerate the mask, the machine, and we open up that airway, and you're breathing all night long, you're feeling more comfortable, you're feeling more rested, you're waking up more rested, you're awake for the whole next day, and your life is so much better, not to mention your spouse's life, which is oftentimes impacted with this illness too.
Let's remind folks that may be concerned about cost and all of that. You take almost all insurances, don't you?
Oh, absolutely. We work with all insurance companies, and all they have to do is pick up the phone, talk to my staff about it. We will begin the process to get them diagnosed and treated.
So one phone call and they're on their way to a much better life, aren't they?
Absolutely.
We do treat varicose veins here at Vein Specialist of Alaska, and the treatment has gotten much easier over time.
My varicose vein was sticking out, protruding, and I didn't want it to do that anymore. It's pretty simple, non-invasive. You're alert, oriented the whole time. It didn't hurt. You don't shed a tear, and your leg looks better.
I'm Shauna with Vein Specialists of Alaska, where we treat you like family. If you have varicose veins, call us today.
If you or your sleep partner is snoring like this, it's time to call Dr. John Krehlik, Alaska's sleep doctor. Sleep testing is easy and can be done in the comfort of your own home. Call Dr. Krehlik today. No matter where you are in Alaska, Dr. Krehlik fixes snoring. Before Dr. Krehlik, after Dr. Krehlik.
One of the main reasons I decided to join Vein Specialists of Alaska was that they are so compassionate about how they treat patients, as well as they don't just treat patients to treat them, they treat them because they actually need it and they think that they can help them.
They went through everything step by step. They took the time if you had questions. It wasn't like a rush in and out job. I was just pleased with it.
If you have varicose veins, call us today.
Hi, I'm Dr. John Krehlik, Alaska sleep doctor. If you or your loved ones snore, it could be a sign of a serious medical condition called sleep apnea.
I was waking up 25 times an hour. My pulse oxygen level was dropping down to 68, and I would go for 69 seconds without breathing while I was sleeping. And it's no wonder I was tired.
Call us today. No matter where you are in Alaska, I can help you.
Dr. Krehlik is very personable, very down to earth, and is very informative. He answered all my questions and continues to see me and follow up occasionally. So he wants to make sure that things are still going well.
Hi, I'm Dr. John Krehlik, Alaska sleep doctor. Call us today. No matter where you are in Alaska, I can help you.
Dr. Krehlik fixes snoring.
We hope you've enjoyed this edition of Alaska Health and Fitness Magazine and our visit with Alaska's sleep doctor, Dr. John Krehlik, and earlier in the program, Vein Specialists of Alaska and Dr. Ty Bell. If you'd like information about either of these practices, just get online to alaskahealth.net. www.alaskahealth.net. And if you're a healthcare provider anywhere in the state of Alaska and would like to be a part of a future Alaska Health and Fitness Magazine program, all you got to do is let us know. Our 800 number is on the screen, and we'd love to hear from you. Well, thanks so much for joining us. We'll see you next time on another edition of Alaska Health and Fitness Magazine.